Good morning, good evening, guys. Again, this is your Professor Edouard Brutus for your nursing assistant training needs. We are on chapter 6 of our manual. We use the Hartman Nursing Assistant Care, the basics, the 6th edition. We are on chapter 6. Okay, so I want you to open your book to page 128, and we're going to take a nice trip through chapter 6. Okay, so the nursing assistant assists the patient with personal care. Okay, personal care is different from other tasks that nursing assistant may perform for the residents, such as measuring vital signs or tidying up a unit. Okay, so personal care referred to a hygiene, which is basically keeping the body clean and healthy through bathing and brushing, etc. And we also groom, do some grooming practices like cleaning the fingernails, the hair. Okay. Also, part of the hygiene is and other care that we provide. We call them ADL care. That we talked about that earlier. Drinking, feeding, elimination need, transferring needs, etc. So the nursing assistant may provide these ADL care in the morning. Okay, assisting with AM care. We're on page 128, and also with PM care, and you can see the list. And these care are also provided as needed, meaning that if during the day patient had an accident, needs to be cleaned up, so that needs to happen. Okay, so the way the NA help a resident with personal care plays a large part in promoting independence and dignity for the residents. Okay, they may feel uncomfortable. The resident may feel uncomfortable having someone else help them with these tasks. Okay, so therefore, the nursing assistant needs to identify herself and explain to the patient exactly what you're about to do. All right. Page 129, encourage the resident to do as much as they can for themselves, knock and wait for permission, not interrupting the resident while they're trying to use the bathroom, give them privacy with phone calls and visitors, okay? And also keep the resident covered as much as possible, okay, during bathing and during dressing. During personal care, again, the nursing assistant should observe and report any abnormalities with the skin that we can see on page 129. Notice the skin color, any change with mobility, any change with flexibility, comfort level, strength, and stuff like that. And also report patients' complaint. Okay. During skin care, the nursing assistant needs to pay attention to pressure points, which are areas of the body that bears a lot of weight, and also bony prominences, which are areas of the body that lies beneath, where bone lies right beneath the skin. Now we're talking about the elbows, the shoulders, the shoulder blade, tailbones, hip, knees, etc. Okay. Go on to page 130. Okay, so as we pay attention to these bony prominences and pressure points, we're paying attention to make sure that we notice if there's any pressure injuries. They often call them pressure ulcers, pressure sores, etc. Okay, now they develop very quickly. You have stage 1, stage 2, stage 3, stage 4. Now, the higher the stage, the worse the wound is. All right. As you can see on page 131, it can get so deep that it gets into stage 4. You see the bones, and then unstageable or even deep tissue injury, and they are very painful. So on page 131, the nursing assistant reports any abnormality again with the skin over these bony prominences. We're talking about reporting any paleness, any blisters, bruises, dry, cracked skin, itchy skin, swelling, rashes, or any changes with any existing injury. The nursing assistant, while providing care, yes, reports any changes, page 131, provide regular daily skin care, reposition patients at least every 2 hours. Reposition your immobile patient every 2 hours. Don't scratch or irritate the skin over any bony prominences or in any ways. Massage the skin often, but use light circular strokes. Be gentle during the transfer. And for patients who are overweight, they may have poor circulation and extra skin fold. Okay, so pay attention to the skin under the fold to make sure it's dry and that there's no breakdown, no skin breakdown. Go to page 132. Okay, now one way to keep the skin intact is to keep the bottom bed sheet tight and free of wrinkles, of crumbs, because these things will, even the tiny wrinkles can expose the patient to developing bed sores. And one of the most important thing to remember also is do not pull the resident across the sheet during transfer and during reposition, because this may cause shearing, friction, and tearing of the skin. Okay. So guideline, we have some guideline to repositioning. Yes. We have patient may use backrest, okay, to provide support. Okay, it could be a pillow, draw sheet to assist with lifting and turning and repositioning and moving the patient up in bed. Hand rolls if the patient's hands fingers are contracted. Okay. Orthotic splints if to keep the fingers, also the contracted finger and hand open. We call these orthotic devices. Okay, call these orthotic devices. They are trochanter rolls. Sometimes we even use the pillows to basically help the patient get some comfort. Okay. Now let's talk about the hygiene. We assist the patient with partial bed bath on a daily basis, and every other day with a complete bed bath. Okay, page 133. A partial bed bath is basically washing the face, the hand, underarm, and the perineum every day, and the complete bed bath is every other day. Before giving the bath, yes, make sure that the room is warm and the water temperature is normal at 105. Okay, you may want to test the water temperature, or have the patient himself or herself touch the water and test it. Okay, but the normal temperature should be at least 105. So during the bath, you want to get a thermometer to measure the temperature of the water. Okay, I strongly encourage watching the video of giving a complete bed bath. Okay, to make sure you cover all the bases. Go to page 134. In the video, you see how they promote infection control by washing your hands and wear gloves. Okay, explaining the procedure to the patient, giving the patient right to privacy and dignity by keeping the patient covered under the blanket, under a bath blanket, and also, closing the doors and pulling the curtains. Okay, keeping the bed at a safe height, because this is good for proper body mechanic. Okay, during the bed bath, basically we have the patient covered as much as possible, and we only expose the area that is being washed, and then we cover it back up. we promote independence by allowing the resident to participate in their own care. Okay, now page 134, the proper sequence. You can see eyes, face, ears, neck. Okay, no soap on the face. Remember that, no soap on the face. All right, and when you watch the video, you will see the special way that we clean the eyes. Okay, then we move on to the arm and the axilla, the hands, chest, abdomen, legs and feet, back. All right, so moving on to page 136. Okay, so you will see that during the care, only the area that is being washed is exposed. The bed is protected with either a bed protector or a towel, especially when we're doing back washing the back. Okay, and the water will be changed as needed. Okay, page 136. Perineal care, perineal area and buttocks. Yes, we need fresh, clean water. Remember, we talked about cleaning from front to back, from clean to dirty, or from meatus to anus, or from urethra to anus. Okay, so this is the proper sequence for perineal care. Okay, working from front to back. And for the male resident, you want to pull back the foreskin and gently clean the skin to clean the glands of the penis, the tip of the penis, and clean and push the skin back and clean around the shaft of the penis, and moving down to the testicles and toward the anus, all continuously cleaning from front to back. Okay, all right. Now again, on your state exam, they may ask you to demonstrate perineal care on a female mannequin. So during the procedure, you need to provide privacy, talking to the mannequin as if it is an actual person, telling the patient exactly what you're doing as you move through the process. Okay. Okay, so when washing the resident, make sure you rinse the soap thoroughly, and that you completely dry. Some patients like lotion, some patients like powder. Okay, so keeping that in mind, and make sure you watch the video on bed bath a couple of times. Okay, the back rub on page 137, we position the patient on the side. Right after we wash the back, we do the back rub, which is basically short, gentle stroke to promote on the back to promote circulation. Okay, as you can see on page 138. Okay, gently massage over bony areas like the spine, shoulders, shoulder blades, and hip bone. Okay, discoloration on the skin indicates as the skin is already irritated, so you want to avoid these areas. Let the patient know when you're almost through. All right. Provide for privacy. Okay, there are videos. I believe we do have a video of the back massage. Let me look at here. If not, then you can also see it on YouTube. But this is not one of the things that you will be tested on. It's not part of the list. Okay. Also, but you need to watch the video because you need to know how to perform that for your patient. Okay, shampooing the resident's hair in bed, page 139. Okay, again, maintaining infection control, all right, by washing your hands, wearing gloves, Explain the procedure to the patient. The temperature of the water is 105. Okay. Remove all pillows and place the resident in a flat position. Page 139. We're on number 7. Okay. Place the waterproof pad under the patient's head and shoulder. Cover the patient with a bath blanket. Okay. Place the basin under the patient's head. Use a pitcher. Wet the hair thoroughly. Apply small amount of shampoo. Okay. So as you watch the video, you will see the steps. Okay, you will see the steps one at a time. All right. If there's one thing that always causes students to fail is forgetting the finishing steps on page 40 when finished, or page 140 when finished. Return the bed to its lowest position. Remove privacy measures like open the curtain, place the call light within reach, etc. Okay. Guideline for the shower and tub bath. Okay. Clean the area before and after use. Make sure the floor is clean. Have the resident use safety bars to make sure they don't fall. Do not leave the resident alone. Make sure all needed items are within reach. The temperature of the water again is 105. Okay. Again, watch a video on, tub bath and shower. All right. We call it giving a modified the bed bath, or or you can watch the bed bath. You can watch the shower video. All right. Oftentimes, on page 141, we use a shower chair. Okay, the shower chair makes it a lot safer for the patient and for us to give us the peace of mind knowing that, okay, yes, the floor is wet and slippery, so I'm keeping this patient safe. Okay, the shower chair is a sturdy chair designed to be placed in the bathtub or shower. Okay, it is water or slip resistant Okay. Again, we don't leave the patient alone. All right. We make sure that the patient is safe. When finished, drain the tub, cover the resident with the bath blanket. Okay. At this time, you may, push the shower chair toward the patient's room. All right. And go and do the finishing steps. If your patient needs to be dressed, then we do that and go back and clean the bathroom, etc. All right. Page 142, we're assisting the patient with grooming. Grooming may affect the way people feel about themselves and how they look to others. So we help them with keeping their fingernails clean. Okay. Their hair brushed, etc. So on page 143 we have the fingernail care video. Please watch the video and practice as you watch it. So basically, I want you to mimic what you're seeing in the video to make sure that you get the skill under control. Okay, you get the routine. So that's the thing with the videos. While you watch it, practice it so you get the routine. Even if you have to fake the moves, okay, but at least your body remembers what you do. Okay, what you do for the patient. Okay. So with fingernail care, yes, privacy, soak the hand, get yourself a basin with warm water. The temperature of the water again is, you said it, that's right, good job, 105. Okay, check the temperature of the water or have the patient check it. Soak the resident's hands and nail in the water for at least 5 minutes, right? And then wash it with soap and rinse it, and then dry it. And then you, on page 143, you use the flat surface of the of what we call the orange wood stick. It's called the orange wood stick to clean underneath the fingernail. Okay. And then we shape the nail with the emery board. Okay. Moving only one direction, not back and forth. Okay. Keep that in mind. Number 12 on page 143. Move the emery board in only one direction, not back and forth. And apply lotions from fingertip to wrist. Okay. And then you practice your finishing steps. Careful foot care is extremely important. Go to page 144. Okay. So basically with foot care, also with nail care, you observe with fingernail, with hand care, you observe and report the condition of the skin. Okay, is it dry? Is it broken? Is it discolored, blister, bruises, blood or drainage, ingrown toenails, swelling, pain? So you would report any of those. Yes, again, you got to watch the video on providing foot care. Okay. Again, the temperature of the water is 105. Place the basin on a mat and right, so you can place the mat on the floor and then you place the basin on top of it, and then you soak the patient's feet for 10 to 20 minutes, page 144. Okay, and put soap on a wet cloth and do a little bit of scrubbing, okay, to remove dead skin, right, between the toes, at the sole of the foot, around the ankles, etc. So, and then you rinse the entire foot. Okay, you put lotion on one hand, you rub lotion all over the foot. Okay, except between the toes. You don't put lotion between the toes. Okay, you would put powder. You dry it thoroughly and then you would put powder. Of course, this process you're performing with gloves on. Okay, and wash, rinse, dry, lotion, powder. You get the orange wood stick again. You clean in between, underneath the toes, the toenails. You get the emery board again and you file the nails. You shape the nails, the toenails. Okay. And then, you know, you perform your finishing up steps, making sure that your patient is comfortable. Okay, that everything is cleaned up. Again, I'll say it. This is the area where most people fail the state exam because they focus exactly on what they're asking them to do and forgetting the finishing up steps. Okay, page 145, pediculosis has to do with, you know, infestation of lice. Okay, that bite the skin, sucks blood, and live and grow. So basically, you know, there's head lice, body lice, and crab or pubic lice. So again, you know, you want to make sure you put your hair in a bun to make sure that, you know, you protect your hair. Okay, you wear gloves, you protect yourself. Basically, we're talking about standard precaution to keep yourself to prevent you getting infected, okay, and to prevent the spread of the lice, okay, throughout the facility to other residents. Okay, so think about that as you combing your patient's hair. Okay, untangle the hair, right? Explain, first of all, explain the procedure. Wash your hands, wear gloves, provide for privacy, raise the bed to a normal working height. Okay, we keep talking about raising the bed to a normal working height because that has to do with you know, proper body mechanic. All right. Remove tangle first from the hair. Remove any hairpins, hair ties. Untangle the hair and brush. Okay, and neatly style the hair as the patient prefers. Okay. Personal preferences on hairstyle should be respected. Okay, now let's talk a little bit about shaving. Okay, shaving basically has to do with removing hair from the patient's face. The nurse assistant must always wear gloves when shaving a resident to the risk due to or because of the risk of exposure to blood and body fluid. Okay, and razors should not be shared, and when discarded they should be discarded into what we call a sharps. We have different types of razors. There's safety razors, disposable razors, and electric razors. Okay, so I need you to watch the video on shaving a resident. Okay, and also, think about asking the nurse which kind of razors to use with your resident, because one has more risk of bleeding than the other. So you need to check with the nurse. Okay, so yes, you're gonna put on gloves. You want to make sure you soften the beard, okay, with warm water, okay, and then you hold taut. You the skin down a little bit, okay, and you shave in the direction of the hair growth. So if I'm holding it taut, I pull it up, and then I shave one stroke down at a time, okay. And under the neck, okay, under the chin, one stroke up at a time, okay. Of course, you're wearing gloves. You rinse the blade, the razor blade, the razor in the water, okay, as you continue to use it. When finished, rinse the resident's face with warm water, wet cloth, and you may use a small brush to clean the razor if you're gonna reuse it again. Okay, make sure if it's an electric razor, you do not use it near any water source or oxygen source. Okay, and then finally, use aftershave. Offer a mirror for the resident to take a look at what you did. Okay, give him that added level of comfort. Okay. Yes, you definitely need to watch that video. Okay. We assist, go to page 148. We assist our patient with dressing and undressing. Okay, remember we had talked about if your resident has history of a CVA, of a stroke, they may have a side that is weak and a side that is strong. The weak side, we call it the affected side, or the involved side. Okay, so number one on page 146, ask the resident about their preferences. So state exam will always want to make sure that you provide the patient choices. Okay, encourage the resident to dress in regular clothes. Okay, let them do as much as they can. Provide privacy. Okay, and always start dressing, whether you're putting socks on, whether you're putting shirt, underwear, pants, dress. When dressing the patient, page 149, start with the weaker side. Okay, start with the weaker arm or weaker leg. Okay, then move on to the stronger side. When undressing, whether it's taking off socks, taking off shoes, taking off shirt, taking off pants, taking off underwear, start undressing from the stronger side first. Start at the stronger side, okay, and then move to the weak side. Okay, we do have a video on dressing a resident. Okay, so I strongly encourage watching the video. As you can see on page 149, this patient remains shirtless while the patient bare skin while the CNA is dressing him. But the fact of the matter is, look at number 8. You should place a bath blanket over the resident, okay, as you undress them from the old clothes and as you dress them with the new one. So the patient should not be exposed, okay? All right. So when dressing a resident, let's recap. Start from the weak, finish with the strong. When undressing, start from the strong, finish with the weak. Always make sure you place a bath blanket over the resident, okay? And when you finish with undressing and redressing the person, this is when you would remove the bath blanket. You may have the resident hang on to it to make sure that it doesn't fall off. Go on page 150, okay? So the same principle remains. Either you're putting on socks, shoes, clothes, pants, okay? Start with the weak, start dressing with the weak, finish with the strong. When undressing, start with the strong, finish with the weak. Page 150, if your patient is on IV therapy, okay, intravenous therapy, which is basically the delivery of medication, nutrition, or fluid through a vein, let's look at the guideline. Number 1, never disconnect the IV line. Number 2, always keep the IV bag higher than the IV site on the body. Number 3, remove clothing from the side without the IV. So when undressing a person that has an IV, start with the side that does not have the IV and finish with the side that has the IV. When undressing, start with the side that does not have the IV, finish with the side that has the IV. When dressing, start with the side that does have the IV and finish with the side that does not have the IV. I repeat, when dressing, start with the side that has the IV in that arm and finish with the side that does not have the IV. Okay, I know I say it a little bit fast, but go to page 150, mark it, and go back and review it. Okay, so first remove clothing from the side without the IV, then gather the clothing on the side with the IV. Leave the clothing over the IV site, move it up toward the tubing, move it up the tubing toward the IV bag. Leave the bag off of its pole, right? The fourth one, leave the IV bag off its pole. Apply clean clothing to the side. So this is when dressing. Apply clean clothing to the side with the IV. Slide the clothing over the bag. Place the IV bag back on the pole, and then move the clothing down the tubing, the IV, over the IV site and onto the resident's right arm. So all of that basically, I want you to go watch the video, because reading it and watching it will make, both of them will make sense for you. Okay, page 151, we have a video of how to put on knee-high anti-embolytic stockings for a resident. Okay, this I believe is number 28 on our list of Hartman video. Okay, you want to put the patient, provide for privacy, put the patient in a supine position, okay, meaning on her back on the bed. Okay, and as you can see on page 151, okay, so you basically almost turn the sock inside out, and then you apply it over the toes, and then you pull it over the leg. Okay, make sure that there are no twists or wrinkle in the stocking. After it's on, it must fit smoothly. Okay, make sure that the heel of the stocking is over the heel